Should women be concerned about heart disease?
Every woman should be concerned about the potential risk of heart disease.
Okay.
That's it. I think
That's
I can't
good.
say more.
So if you're a woman who's been pregnant and you've had complications, like what do you do post-pregnancy? Like what action should they take?
Yeah, one of the things that definitely needs to happen is that if you haven't been under the care of a cardiologist during pregnancy and you've had complications, that you do need to see a cardiologist. For my patients who are at high risk for developing complications or have had complications during pregnancy, I follow them throughout their pregnancy, and I'll see them once every trimester. And then usually I'll follow my patients for about 3 months. If everything is looking good, blood pressure is under control, then I transfer you back to the care of your primary care physician.
Should women be concerned about heart disease?
Every woman should be concerned about the potential risk of heart disease. Heart disease is not an old man's disease. It is important to understand if you're having symptoms or if you have risk factors, that you need to see someone to be evaluated to ensure that at least you undergo appropriate testing to see if your symptoms are a sign of heart disease, and if you do have those risk factors, they're treated. So yes, women need to be concerned just like men.
Lipoprotein A, what is it anyway?
So lipoprotein A is a specific type of cholesterol. It looks like that bad cholesterol, the LDL cholesterol, but it actually is worse as far as this risk for developing cardiovascular disease. What we found is that for those who have high lipoprotein A, there are things that we can do when it comes to their risk factors that we need to modify that will reduce their risk of having a cardiovascular event until there's a medication out there specifically that will lower lipoprotein A and prevent cardiovascular event.
What's a Mediterranean diet anyway?
That is a diet that has been shown to improve cardiovascular health. It consists of eating foods that are low in saturated fat, high in protein, not so much animal protein, but chicken and fish. It also is high in fiber, fruits, and vegetables. And it also includes the healthy fats, avocado, olive oil. Those things comprise a Mediterranean diet, and I advocate for it for all my patients.
When we think about age demographics, is it really the elderly that should be concerned about cardiovascular health?
Well, we all should be concerned about cardiovascular health. While we know that the risk of cardiovascular disease and some of those risk factors increase as we get older, younger people are being affected by cardiovascular disease. And that's because younger individuals, younger women, have those risk factors for cardiovascular disease. So it's not just an age-dependent thing. We need to understand what those risks are, and each one of us undergo our own individual assessment with a doctor.